Okay, so we have a few more participants, so let's begin the session now. Welcome everyone to the last classroom session for the CLC1 Supply Chain for Health course. This session was originally planned in the first week, but since we were not available during that week, so we had to put it at the last because we could not just break the flow of the course. Before we start, I would like to apologize for the gaffe with the time. It was not intended, but the time of the sessions were fixed at 4 p.m. only. So apologies if for some reason the invite showed 3 p.m. I've sent messages to the group to see if people can join. Today with us, we also have Director of Supply Chain of Be Skilled, Mr. Pierre Divesson. He's a senior supply chain expert working with multilateral organizations and country governments in Francophone Africa and a lot in Southeast Asia as well. He has supported many countries and supply chain organizations in creating and revising supply chain strategies. And hence today he's with us to talk about supply chain governance and why it is important. And that's what the topic of this session. Um, for today's session, we will understand how supply chains are governed at the country level, what are the various issues linked with it. We will also discuss a key point with this, which is very intricately linked with governance of supply chain, that is the flow of products, money, and information, which of course you must have looked in the initial modules of the course, and there was an assignment about it as well. Ideally, we do this class up first so that you get to understand those flows very clearly. Uh, but anyhow, we will do that today so that you can bring back the learnings from those initial modules today and uh, you know uh, have a great discussion during the class. At the end, there is a discussion as well. So depending on how many participants join, eventually we will decide whether to do that discussion in groups or directly in the plenary. But we can decide right at the end. With that being said, let me hand over to Pierre to take the initial part of today's session, and then I'll be back with the second half of the session as well. So, Pierre, do you want me to control the slides, or I've just given you slide control?
Okay, okay.
You
Like a
can also
grown-up,
do.
I will be able to manage that.
Okay, so over to you, Pierre.
Thank you, thank you. Hello to everybody. Hope you're doing well. Um, you will have to get used to my French accent, speaking English, which is very different from Sanjay's accent. This is the diversity of the world. I'm usually a French trainer. And today's lesson is about governance. So governance, you need to make sure that you understand what is meant in governance. Of course, the Minister of Health is the decision maker, the ultimate decision maker on everything that is happening in health. Now, remember that we're talking about supply chain. So we're talking about the governance of supply chain. And this is a tricky subject. Why? Because governance in health is not necessarily the governance in supply chain, because supply chain is at the service of health. And some people in some countries, Zimbabwe is one of them, would believe that governance is such or such or such. And actually, practically, this might not be true. Formally, this might be true. So actually, it's very complex, and it depends on the situations in lots of countries. Because this is something that we, the consultants, usually believe is not very mature, because this is only supply chain and this is not health. So that means it's a subcomponent. Governance refers to the oversight of the structures and the processes that enable the direction and the control of a system, an organization, or a country. It eventually guides power sharing amongst various shareholders and orients the responsibilities and actions of individuals and groups within it. So, to illustrate what are the roles and responsibilities of governance, well, let's start with the word of governance. Govern, it governs. And within the meaning of governing, there's actually, I prefer conducting than governing. But imagine that the governance conduct, then two analogies. The pilot of the aircraft is the one conducting the aircraft, piloting the aircraft. A driver of a car drives the car, conducts the car. So basically, it set the policies and the standards. He says, that's how I drive. I don't drive like a crazy guy, a Formula One driver. I have standards. I have a policy. I want my passengers not to scream at me. I'm the one making the decision on making the decisions. And here we have the second circle, which is allocating the funding resources, defining and coordinating with stakeholders, monitoring and evaluating, managing the risks, identifying the roles and responsibilities and related boundaries, defining accountability systems and communication routes, ensuring sustainability of the system. So basically, the governance is responsible of making the calls, the decisions. And there's plenty of themes: monitoring and evaluations, standard policies, standards, funding resources, risks, that the governance of the supply chain is supposed to take action upon. Usually, and I think you went through that, you have 8 operational functions, and you have 5, so which is from qualification to specification to quality assurance. These are direct functions. Functions in supply chain operationalize the supply chain. Governance is one of the 5 enabling functions. They enabling the operational functions. Governance is the number 1. Governing, coordinating, governing, leadership, governance, leadership, and coordination. This is all under governance. So now the question comes, who's governing the supply chain in your country, or generally speaking? And decision, actually, the response to that is not very clear-cut. You could have a centralized system, or you could have a decentralized system. Decentralized means that the central level will provide broad guidance, and the level below, it could be a province. I don't know enough Zimbabwe, I've never been there. Is it a state? Is it a district that has the power given by the central level, delegated by the central level, and they often decide on how to allocate to some extent, how to allocate the funding, who to empower. There's plenty of examples, but you have here on the left a centralized health system or supply chain system, where you have the federal government and you have the central stores, and the state, province, county levels have very little power. They just aligned with what has been decided centrally. And then you have the beneficiaries, which are the health facilities. Now, on the right side, you have a system that is decentralized, where the federal government will set broad health policies, federal budgeting allocation for states, counties, provide the guidelines. We're talking about guidelines. Guidelines is non-binding. Guidelines for procuring, warehousing, and distribution. And this is to the lower level to actually decide specifically in the range that has been given by the central level to decide, well, this is the way we're gonna operationalize it. And so you have often different variation of centralized, decentralized governance or mixed governance. We hope it's clear. Now I will illustrate with different countries, and the next question will be, and we hope that the 12 of you guys online will be able to tell us, where do you think Zimbabwe is? So you have Ghana, which is centralized. There's in Ghana, within the Ministry of Health, the Ghana Health Service Department and the National Health Insurance Authority. And the health services is responsible for developing policies, standards, and guidelines for the health sectors. And oversee the implementation of these policies at the regional and district level. Then the National Health Insurance Authority provide the access to services by prepaying the access to the health system. So the prescription and of course the products. So you see the Ghana Health Service oversees the overall management of the health supply chain, including procurement, warehousing, transportation and distribution, inventory management. Now you have on the decentralized extremity, the other one, you have Nigeria. Nigeria is a federation and there's 36 states. So the federal level is responsible for formulating the broad policies related to health and to supply chain. And you have State Ministry of Health that will actually operationalize and decide on how, on how they operationalize the supply chain, how to implement the policies and the management and how to deliver health services. And then you have logistic management, LMCU center, Sanjay, can you help me? Logistic management.
Yeah, coordinating unit in Nigeria.
Coordinating unit. So it's therefore about governance because they coordinate. Now, what I dislike with the word of coordinating is that coordinate in Latin means put in order and sorting. And in sorting, there's no trace of decision making. And the governance the minister or the conductor of of an aircraft or a car is the one deciding, receiving the information, watching what's happening in front of them, getting the dashboard saying the fuel is at this level, you have a problem in the motor, in the engine, etc., etc. You have a flat tire, and making the call saying that I stop now, I stop later. So thanks to this visibility, the person is able to get the information, analyze the information, and number three, make a call and make sure that what has been decided is acted upon so that the car, the aircraft, or the Ministry of Health is able to move forward. So logistic management coordination unit, why not? I'm not in favor of that because it doesn't tell exactly what's happening. And better than coordinating, there's making a decision. Governance is making a decision. So LMCUs are making the decision of the supply chain activities within the state and coordinate with the central level NPSCMP, which is the beauty of supply chain and healthcare, is that we create acronyms very difficult to tell. And then, of course, you have 774 local government areas with responsibility in staffing, maintaining healthcare facilities, and the management of healthcare program and service at the community level. So in between the centralized Ghana and decentralized Nigeria, you have another example, which is Kenya. That is actually a little bit different. It's a mixed, taking a little bit of both. And the governance, lots of power are given to the county governments that will be able to go to the agency that is centralizing the supply chain called KEMSA, Kenya
Medical Supplies Agency. Yeah.
Medical Supply Agency. Yeah, I forgot this one, despite we visited together. And then county will decide to procure, what to procure, which quantity. Everything is working like that, but the counties have the authority to decide. In this case, in Kenya. Now the question is, for Zimbabwe, who's the primary stakeholder, who's governing, coordinating, and therefore who has the leadership in Zimbabwe, who has the supply chain leadership in Zimbabwe? Can we pause here and have a little bit of discussion with you guys? Who would like to talk about the situation in Zimbabwe? Back to you.
Hi there, it's Lou here. I believe that there's in Zimbabwe there's an organization, a parastatal organization called NatFarm, which is overseen by, or it reports, I think, into the Ministry of Health. But this is actually something I really want to learn. So I'm hoping that one of my fellow participants understand the relationship between NatFarm and the Ministry of Health a bit better.
Thank you very much. So that's a good start. Now, let's not forget that often the person governing is not the person operationalizing. And when I heard you talking about the name of his agency, I suspect that they're the one operationalizing. Operationalizing what? Procurement, often essential medicine, because program product is given by the donors and technical partners. The Global Fund, USAID, are providing the products. So no procurement for program product. Procurement probably, there might be co-procurement, might be. But warehousing is done centrally by this agency. And I suspect that at the intermediary level, they do warehousing as well, intermediary warehousing, so from central to intermediary. And after that, there's the transportation distribution piece. But to illustrate precisely what I'm saying is that imagine the pilot of the aircraft. He's the one deciding, receiving the information by looking at the dashboard and the cockpit. Then he's the one providing the analyzing and making the decision. An example, there's a flat tire. The pilot will receive a red signal and say, and analyze that. Say, okay, there's a flat tire. Do you think the pilot will go down to change the tire? This is very technical. And his role is not to change a tire. His role is to get the information, analyze the information, make a decision, making sure. So he will call the technician and say, can you please change the tire? Because can you please verify that the tire is flat? Then number two, change it and report to me back when it's done. This is what is done on an aircraft. So you have a distinction between the people operationalizing and the people deciding. Governance. If you don't, you have a conflict of interest. And another analogy, in a soccer game, the referee is the governance of the game. He's neutral and he doesn't make a goal. If he makes a goal, there's a conflict of interest. So governance is often higher up. So it might be the board of administrators of this agency, maybe. But I suspect that within the Ministry of Health, there's an agency, a department that has a board member within this agency. So I just wanted to clarify everything because this is very important. And in lots of countries, this is poorly understood. And we will touch upon that later. Who else would like to provide more details? But thank you very much for kickstarting the discussion. I hope it makes sense.
Yeah, no, that does make sense, and thank you. Yeah, I do believe that the governance aspect is carried out by the Ministry of Health and Childcare, and the day-to-day operations, procurement, warehousing, distribution, data analysis, etc., is all coordinated by and carried out by NatFam.
Exactly, but if and remember that the Central Procuring and Warehousing Agency is not the only stakeholder in the supply chain. If you have intermediary levels, for example, districts, they are part of it as well, very important. Now, health centers, they have the last storing point before patients. They are even more important than the Central Procuring and Warehousing Agency. So remember that the Central Procuring and Warehousing Agency might be the backbone of the supply chain. They are not the only one in supply chain. And often in some countries, this is forgotten. And when there's a quarterly or monthly meeting with the stakeholders of supply chain, they are not there, they are not represented, which is a mistake. And that's often the reason why the health centers and the district level, I don't know exactly what is in Zimbabwe, they are not improved, not efficient enough because they are not part of the discussion. They are not part of the coordination. They are left alone. I don't know the details of Zimbabwe. Please chip in. Hope it makes sense as well. Back to you. I don't move on if nobody else is speaking about the situation in Zimbabwe. Don't be shy. If you don't want to put the video, we will hear your voice only.
Hello, good afternoon, colleagues. My name is Wilson Mzodiwa. Unfortunately, my internet is unstable. I hope you can hear me.
Very well. Go on.
I wanted to talk about the supply chain authority in Zimbabwe. The way I know it. My understanding is that the Ministry of Health is the main authority through its Department of Pharmaceutical Services, which oversees the parastatal known as a national pharmaceutical company, NatFarm in short, which is the way it is popularly known in the country.
So, and another question for you, but thank you for the details. The Department of Pharmacy, is it the regulator of everything that is pharmaceutical in the country, or there's an FDA type of regulator, like a little bit the US FDA in Zimbabwe?
While the pharmaceutical, the DPS, the Department of Pharmaceutical Services, is a government department overseeing the national pharmaceutical company. I think I think it's the ultimate stakeholder.
That's not my question. My
But
question
course,
is it this DPS, Department of Pharmaceutical Services, is it the one registering the product that is going to be sold in Zimbabwe? Yes or no?
The authority that registers medicines is called Medicines Control Authority of Zimbabwe, which if you are importing, for example, medicines that are not already registered in the country, we make an application to the Medicines Control Authority to get exemptions or to get the medicines registered. So in terms of registrations and control of the medicines, that is the ultimate authority. But I understand it's also a parastatal which falls under the Ministry of Health and Childcare.
So the regulator is this MCD, Medicines Control Department, is some kind of
It's called
MCA.
It's called MCAZ for Medicines Control Authority of Zimbabwe.
Okay, MCAZ. Okay. Because in lots of countries, actually, the authority, the governance body of the supply chain is actually the regulator. And this is a problem because governing the supply chain is somewhat operationalizing it. The referee in a soccer game cannot be part of anything in the soccer game.
In our case,
this is not.
in our case in Zimbabwe, it's different. Because
Exactly.
the
This
supply
is what
chain
I'm saying.
is,
This is exactly
is entirely mandated to the national pharmaceutical company, which
yes,
is different from
exactly.
MCAZ, the Medicines Control Authority. So there is separation of
Yes.
roles there, or
Yes.
powers. Yes.
Yes. So in that sense, there's a clear separation between regulatory and supply chain. Regulatory will say, look, this is the good warehousing standards. This is the good transportation standard. This is how warehouse should work. This is the number of pharmacies that you need to have. This is how quality assurance should be managed, because the regulator's role is to regulate. Number one, setting the rules. Number two, inspecting the rules. Number three, if the rules are not met, to make it how do you say that, to make the decision to stop the entity to handle pharmaceuticals. This is a role of the referee. And on the top of that, of course, approving, investigating, and approving the products to come in the country. Number four. Number five, to approve private pharmacies or public pharmacies to be set up, and of course to investigate them. So if it's the case, there's a distinction between governance and regulation. In lots of countries, there's no distinction, and it's a bad practice, not recommended by some regional agencies in Africa and by WHO. Now, in this case of Zimbabwe, that's a good point. The Ministry of Health has a department called Department of Pharmacy Services, who's the governance body, coordinating body, and has the leadership to make a call. And contractors, some of the contractors, one of them is called NATFA, correct?
Yes, net farm.
NatFarm. And then that's probably at the central and intermediate level, doing activity number one, performing activity number one, procurement, quantification, specification, activity number two, procurement for different kind of products, especially some medicines. Number three, central warehousing and probably intermediary warehousing. You will confirm that. Number four, transportation distribution. Now, there might be at the intermediary level and another level that doesn't belong to this agency that is doing, pardon me, intermediary warehousing. And after that, you have another third stakeholder doing local peripheral storage, mainly the health facilities. Is that correct?
Yes, it's correct.
Okay, so thank you for your involvement. So now we know who has the governance of the supply chain in Zimbabwe. We know who's operating the functions, implementing the functions. So there's a clear distinction. Now, the Department of Pharmacy Services, do they operate? Do they procure? Do they warehouse? Do they do something that is about operations? Back to you. Or it's only governance and then coordination and leadership? Do you know that?
I wanted to give my opinion. I
Yes.
understand some of the colleagues in this course might be working directly with the department and might have more information. But from the point of view of our engagement with that department, I know one, they have an overall authority of overseeing the other two departments, which the other two parastatals, which I mentioned, and they also coordinate other stakeholders, especially the donors and NGOs that bring in financing of different commodities. So I think they have a certain level of responsibility in terms of quantification. Actually, they are the ones that are leading the quantification and also ensuring that financing for those commodities that are required by the country is secured, and also how that is coordinated to ensure when the tasks go to their parastatals, either for the supply chain, raw chain,
okay. Yes.
it's all through that department. But
Okay.
the finer details or the specifics, it will be done by their parastatals, depending on its role.
Okay. Okay. So you confirm that the DPS doesn't do procurement, doesn't do warehousing, and doesn't do transport distribution. This is outsourced to a parastatal.
Yes, I do confirm that. And that parastatal is a government company.
Yeah, parastatal.
Meant to do those responsibilities for the government. Yes.
Now, at the lower level, at the lower intermediary level, is there anybody else warehousing than this parastatal? District level, for example, county level.
For example, we have got the central warehouse for NatFarm, and it also has regional warehouses, which we call provincial warehouses here. And at district level, then the responsibility goes to facilities where the hospitals will have their own storage for the commodities that they receive from the regional warehouse.
Okay, so that means that at the district level, the district hospital will have a larger storeroom, which might be called a warehouse, and then will take the product, use for their own purpose, and then the rest will be requested by the health centers in this district. Is that correct?
Yes, that is my understanding.
Okay, so that's exactly what I told you. NatFarm is one of the stakeholders operationalizing the supply chain, but they are not the only one, because district level will warehouse, will transport, and then this is, for me, what we call intermediary warehousing, lower intermediary. And after that, you have peripheral warehouse storing. This is not warehousing, because warehousing is a bigger facility, and often you deal with pallets. At the level of a facility, this is a storeroom, small, large, with several shelves, and this is a very important stakeholder, the third one, operationalizing the supply chain. So that's very good. Thank you very much for all these details. So I think now we touch the situation in Zimbabwe. In terms of funding, This is definitely the DPS, that's funding policies and availability of funding impact decision making, whereby leaders allocate available funding for supply chain functions. Effective policies can be strengthened, can strengthen decision making, but insufficient funding can lead to inefficiencies and corruption. Sorry, I forgot the before. Who's the primary stakeholders of Zimbabwe's health supply chain? We said governance is within DPS, and operationalization is within NetFarm for the central and provincial level. And at the district level, we have another stakeholder. And of course, we have the health facilities. Who's allocating the resources? The last square is the central and provincial level. Who's doing stakeholders management coordinating? This is more DPS. Who's operationalizing the processes? We just listed these three. And then supply chain processes, North Farm, and then district level, and then peripheral level. So
Yeah.
now,
Pierre, can I have a one quick
yes,
one sentence to add to the last slide, which you were showing? The reason why we focus a lot on these questions here, because academically speaking, it becomes easier to draw the lines on who's governing, who's operationalizing at a central level or a intermediate level or a peripheral level. But practically speaking, when we go deep and look at the actual situation, the waters are a bit muddy over there. The lines are a bit blurry over there in most countries, I would say, even in Zimbabwe, because the health systems are designed in a way where organizations, they don't report to a central parent organization, so to say. So for example, let's say if NatFarm is reporting to DPS or Ministry of Health, who are the health facilities or hospitals reporting to? If we talk from a supply chain perspective, definitely they are not reporting to NatFarm. We don't know whether they are reporting to Directorate of Pharmacy Service,
yeah.
or who Department
Yeah.
of Pharmacy Service, or who at Ministry of Health. So at intermediary and peripheral levels, those lines get a lot blurred, and hence supply chain becomes quite complex because of how those coordination and communication structures are eventually then managed. So it's very important for all of you to go look deeper into your systems, because supply chain works well when all these things are quite smooth. So if you compare a public sector supply chain to a private supply chain, you will see that in a private sector supply chain, these lines are quite clear. You know how exactly the communication is happening, who's governing, who's operationalizing, so on and so forth. But in public sector, those demarcations are not very clear. And that was the reason why we are having this discussion, so that you can go back, look deeper, and at least even for your own understanding, get a better idea as to how it is happening in your own country. So that was the point of this entire exercise that Pierre was undertaking. So Pierre, back to you.
Yeah, thank you, Sanjay. And if I come to see you in Zimbabwe, and I will probably win the bet, because I have lots of, Sanjay and I, we have lots of experience in lots of countries, and often district level depends from another department than the DPS, and then health facilities as well. So that means that actually there's no direct line of command between DPS and the district and peripheral level. So when DPS said, we will reform, we will improve the supply chain, actually they have no authority on the district level and peripheral level. So they will say, we want to do that. but they have no authority, and the health facilities will say, we don't care. We don't give a flying flamingo about your decision. We don't depend from you. And that's exactly what Sanjay said. It's blurry, and often this is where the problem comes from. This is the root cause of lack of reforming and lack of efficient and effective supply chain. Back to you, Sanjay.
Yeah, I was saying you just have about 10 minutes to finish your part.
Okay. Big boss is very strict. I need to be very careful. Line of command is very strict, you see. So think about it, and often I'm probably sure I'm right on this one, and that's the reason why the supply chain is not as efficient and effective as it should be in Zimbabwe, because there's not a direct line of command, and then you will have a conflict between the DPS and one or two other departments. And that's the reason why the advocacy of Sanjay and me, with lots of experience, is actually to have the supply chain a mechanism so that this line of command is clearer, and then supply chain is under a very specific system, line of commands, so that decisions could be implemented. So I'm pushing the slides here and they're not responding. Yes. So what affects the supply chain? When can impact the supply chain? Funding, if there is not enough funding, or the funding is not clear, or it's only central. I've developed a strategic plan in a country where all the money went to central, and it's always the same thing. This is at the peripheral level, at the district level, that the problems are, because there's less expertise. So funding should actually be there, go there, not at the central level. Human resources, same thing. When we are in the capital city, then salaries are higher. But when we are in a village, in the middle of nowhere, the Pampa, then you have less human resources. It's difficult to hire. The salary doesn't correspond, and then the expertise is just not there to be hired. Information technology. So you familiar with ELMIS and LMIS? Often the lack of logistic management information system will impact and affect the supply chain. If there is one effective and efficient, then the visibility of data is there, and therefore the governance could use that, analyze that exactly like the pilot of the aircraft, and able to make sound and evidence-based decision. And when a decision is made, number 4, then number 5, next month, I would like to see that the red light has become a green light. That is the role of governance, is to make informed decision by what? By information, and making sure that they've been implemented. If all the supply chain had a governance whose role is understood as this one, and a good line of command, then things will move. If it doesn't exist, or there's one missing link, things will not move. Regulatory, if the regulator is weak, then you will see that there's no structure. Everybody is doing anything. There's plenty of illegal product in the market. The person, the agency or entities running poor warehousing will not be decommissioned. There's no penalty. There's no teeth into the regulatory. Things will not improve. Lots of countries with this kind of things. And then when there's culprit for diversion of product, for poor or illegal poor quality or illegal product, there should be sanctions so that people have an incentive, people, agencies, stakeholders, even WHO or UNICEF, often they say, oh, we don't want to integrate the supply chain of the country because our warehouse is better. Go and inspect. This is not necessarily the case. So the incentive for them, if they were inspected and audited by the regulator and say, well, you don't meet our standards. If you don't improve in 6 months, we decommission you. Regulatory will be in their role to do that. Same for private pharmacies. Then number 5, geopolitics can impact supply chain decision making by affecting trade policies, political instability, natural disasters. I recently worked in Nepal. Geopolitics is that earthquake. They don't have tsunami. I worked in Myanmar, there were tsunami. In Indonesia, tsunami. Then you have storms, you have civil uprising. This is very important, and that impacts the governance of supply chain. DR Congo, the reason why they have autonomous supply chain, and especially at the regional level, is because the politicians used to steal from the regional warehouse. They say no more. Every single regional warehouse will be run by local stakeholders. And local stakeholders will say to the politician, we stand in front of the door, you will not enter, you will not steal, and you will not give that to electors. Geopolitics plays a role. Nepal is very close to India, so that means the 90% of the importations coming from India, very little from China, because China is very close, but there's no road coming from China or little road coming to China and Nepal. And the donor ecosystem, sometimes you have USAID who's very strong, you have the UN as well, sometimes they took over some of the governance structure and the operationalization, they subcontract. It happens in lots of countries. Often donors have a representative delegates within the governance structure, which is the case in Rwanda, where there's a monthly meeting with all the stakeholders operationalizing, and then there's debates, there's a decision-making process. You see, all these kind of things affect the supply chain. Sanjay, do you want to take over that, or shall we do it?
Yeah, we can do it very quickly. The idea here is, let me.
So what you could do is you list the participant and you ask them to have a role and to pick one and say if it goes to governance or it goes to management. Operationalization is a better word than management.
Yeah. So the objective of this is to fully understand what are those activities which fall under governance, and then what are the other activities which are under operationalization or management of supply chain. So these are all supply chain activities. So maybe if everyone is okay, you can come, you can unmute yourself and just pick one box and say which circle that it belongs to. If we can do that quickly, then
left
we can
or right?
move on to the next part.
So Lawrence Mabiala, would you, sorry, Sanjay, the first one is data use policies. Where do you put it, governance or operationalization / management? Policies around data use. Let's making sure that everybody's speaking. Lawrence?
Yeah, it might be tough, Pierre. Maybe we start with Muzondiva.
Okay.
Data use policies, I'll put it under governance.
Okay.
Why?
The reason being that the policymakers determine who should access which data, and
Yeah.
also the data will be used for
Yes.
other things that are done
Yes.
at
Thank you.
government
Thank you,
level.
Lawrence confirms that it's governance. Often policies is made at the governance level because policies is a way to put a frame to decision making after decision making. Congratulations to both. Next one is Lou. Where do you put defining supply chain processes?
I'd also put that under governance.
Okay. Thank you. Margaret, can you please tell us who is responsible for allocating budget and resources? Easy. Margaret, do you hear us?
Yeah, you can also write it in the chat if you want, but it has to be
Yes.
quick.
I think I'll put it in management.
So
Okay.
I think you're touching a good point. If it's decentralized, of course, it's in operationalization, but if it's in a central level, then it's governance. So it could be both.
Yeah.
Are you okay with that, Margaret?
Okay, yeah, it's fine.
Okay, that was a tricky one. Who's the next?
Not
PTAP.
yeah, not sure what the name is exactly, but
PTAP.
PTAP Umanei.
Umene.
Not sure what his
Who
name
are
is.
you, PTAP?
Anyways, so it's his turn. So it's the question is defining procurement methods.
PTAPs. Fumene. It's your time to speak. Okay, next one. Massiva or Massiva. Can you please speak? Don't be shy. Massiva. Hey,
Okay.
Sanjay, if you need to have a way to unmute people and say, now you need to speak.
Yeah, someone is speaking. Yeah,
Massiva, yes.
Massiva is speaking, yes.
Oh, right. Yeah. Sorry, guys. I had to quickly dash out for a bit. Let me just
Yes.
came back. Can I just quickly ask if we're doing the next one? Is it defining procurement methods
Yes.
Yes.
you guys are talking about? Okay, I think I would say, okay, defining. I think I would go governance on this one.
Okay.
Yeah.
Okay. Sanjay, what do you think? The issue is that Sanjay, I think defining could be tricky.
Yeah, I mean
What do you mean?
Yeah, it has to be looked at deeper, because there are two of them which may sound similar. So one says policies, the other says methods. So here we have to make a bit of a
Yeah. Policies is often governance. We agree with that. Now, defining procurement methods, so is it a national procurement or international procurement? That for me, if you put not defining but choosing procurement method, for me, it's operationalization. Defining.
Yeah, it's the same. It's the same. It's defining or choosing.
Next time probably it's going to be smarter to put choosing instead of, because
let's say it's choosing.
the procurement policy will tell if it's international or national. So probably setting will be policies, Yeah, governance and exactly. Okay, so Masiva, thank you. You actually solved 2 problems.
Oh, you're welcome, guys. Thank you.
Oh, you're very good. Okay, Tande Muhevihi. Next one, providing enabling legal framework.
Okay.
Hello, who's speaking? Tande. Okay, Tande is responding, yes, governance, enabling legal framework, yes.
Okay.
Would you do as well defining HR policies since you're responding so fast? Governance, yes, very good. Very good.
By the way, there are
Okay.
2 Tendais in the group. Just so you know.
Oh, sorry. Yes, right. Right.
Yeah.
Okay. Selecting supply chain.
Suppliers.
Suppliers, the other Tande.
He already commented on the HR policies, by the way.
Yes. So can the other Tande respond to selecting suppliers? That's an
Zimbabwe.
easy one. Zimbabwe. Okay. Tande one time. Tande Zimbabwe. Can you decide, please, first? Don't be shy.
Okay, maybe he's thinking.
No.
Maybe we can go to the next person.
Okay, Viviane. No, Tinashe. Silas
Yeah, Tinashe Silas.
Tinashe Silas. Can you please answer this one? Is it a governance responsibility? Oh, yes. Go ahead.
Good afternoon, colleagues. Yeah, my surname is Fusire, or you can call it Fusaya, whichever way
Okay.
is good for
Sorry.
you. No, it's fine. Confirm we are talking about selecting suppliers.
Yes.
I think that one is management.
Correct.
So
Very
I would
good.
put it under management.
Okay. So can you answer
Yes.
the other one, managing stock? This one is easy.
Yeah, managing stock, it's management as well.
Of course. Okay. You answer so well. What about developing forecasts?
I think I should leave.
No, answer this
This
one.
Yeah, I would put it under management as well.
Yes, very good, very good. I mean, you know what is operationalization, slash management and governance by now. So, who's the next one? Thank you very much.
All right, thank you.
Yeah, we have Vivian.
Vivian, selecting information system.
I think it's management.
Yes and no. This is a tricky one because it's a decision making and it's a structural one. So when you select an information system, if it's a module of the warehousing, for example, information system, that could be done by operationalization. Selecting an information system for an entire country, it requires often a technical assistance to get the panorama of who's doing what, where, with what software. Then after that, there's the idea to integrate, to have only one, and then what are the specification of a, you see, this is structural, so probably governance. Try the other one, selecting forecasting method. So for example, medical intervention, historical data, consumption data, or morbidity data. These are the 3 methods, some of the 3 methods. Vivian, what do you think? This one is operationalization slash management, or this is governance? Vivian? Are you back? Vivian? Management, yes, very good. Sanjay, you could, so this, the answer is management. Selecting information system, ERP, this is similar to the previous one. Thank you, Vivian.
I think we can just quickly stop here because we have
Okay.
gone through all the students. I mean, the overall crux is important to understand, and whenever it is high level
Yes.
decision making, those are more governance duties, which have to be, which have to go through the decision makers at the
Yes.
highest level. But when it is more about the activities, the day-to-day activities or activities which are part of the process, then they are more operationalization and management. I think that's the crux of the story which we are trying to address here. So maybe Pierre, we can go to
Okay.
the next one.
Yeah, next one.
It's Q&A if there is any.
Okay. Any question? Any question, guys? Don't hesitate.
No, none for me.
Okay.
Okay, I guess in that case we move forward.
Okay.
Sorry, Pierre,
la,
I have a quick
yes.
question.
Yes.
Okay.
Sorry,
Welcome.
for the selecting the forecasting methods, right? Why isn't it on governance? Because shouldn't they be the ones to decide what systems should be used, and then management is just about making sure that they maintain the system and everything runs the way it should.
So again, it's selecting what?
The forecasting
selecting
methods.
forecasting. So it's under management.
Yeah. So I was just asking why it's not under governance, because shouldn't they be the ones to decide what the methods should be, and then management is just in charge of just making sure that everything runs smoothly?
It's a good question. I would say probably selecting is confusing. Using the word selecting is confusing, Sanjay. No.
I think we need to maybe just go a little deeper. Yes, I believe the word is a bit confusing. But I think from a governance point of view, the decisions which are made in any supply chain is number one, how and who collect the data. So how the data will be collected, what kind of data will be collected, and who will collect the data and from where. So that is a bigger governance decision which generally is taken at a committee level or at a higher level. But when it comes to finally doing the or preparing the forecast, because the methods on how you prepare forecast, they are much more down the line when your data is collected, and the forecast team, they have a good visibility on how they want to prepare the forecast. So that's when the method comes into play. So that is more of an operational role rather than a more decision making role, because forecasts can be developed using 4 or 5 different methods and then reconciled as well. We haven't really seen any policy at any country level. Pierre, correct me if I'm wrong, but I don't think we have seen any policy document at any country level which specifically states what kind of forecasting method to use, or that every team in any supply chain, they're restricted to using such type of method, because that is generally not how they set policies. So when we also talk about governance, we also talk about if there are any policies or guidelines to that effect. So generally, when it comes to the developing those forecasts, that is more of an operational decision rather than a very high level governance decision. But if, for example, if we talk about data, what kind of data needs to be collected, who will collect it, or from where they will collect. for me, those kind of things are generally decided at a committee level or at a national level when, let's say, national forecasting begins. But again, the word might not be in that slide. We may have
Yeah,
to
I
change.
think maybe the word you're selecting is a bit.
It's
Yeah,
mostly the
Yeah.
word that's correct.
yeah.
Yeah,
Th-
confusing.
Thank you for your question. But basically, I just developed a course that we're reviewing with Sanjay called root causing.
Okay.
And then when you look at the root cause of symptoms, problems in the country, it goes back often to governance. That means that the governance is not clear. Somebody is not doing their job properly for very good reason. And if there is nobody like the pilot of the aircraft, who's the conductor who makes the call, integrating everybody around that decision, integrative decision, and then consensual decision, then things will not work. This is often the reason. And if there is not a clear distinction between who's deciding and who's operationalizing, then this is gonna be chaos. And so you imagine the logistic management unit, if you call them like that. I prefer supply chain conducting unit made of a decision maker, a director, a chief, whatever you call it, with a permanent staff, but once a month, a meeting where data have been gathered, data have been, number one, number two, data have been analyzed, number three, they are presented saying, is it a green light? Is it a red light? If it's a red light, then we need to make a decision together. This is the problem in this district. There's these people managing these districts warehouse that have very little competency for very strange reason. So we need to train them, we need to replace them, we need to provide technical assistance. Who's gonna do that? You, the Germans, you, GIZ, you, USAID, you, whoever. You do that for 3 months. After 3 months, we will report back and we'll see if the indicators are coming back. All in agreement? Yes. Okay. Let's put that into music and then things improve. And so you need a clear distinction. You understand that forecasting, the governance could say, okay, the forecast for the entire country for all type of project will be done in September. This is the SOP. You do it. I send the invitation because I'm the governing body, and then you do it and you report back. They report back. They say, this is the qualification for essential medicine for program products. This is the need. This is the quantity. We have a gap. Okay, me as the governor or the conductor or the pilot, I need to go back to the donors to ask for more funding. This is the role of actually a minister who will say, hey, come back here in my office. I need 20 million US dollars more for next year. This is the plan. This is what we would like to achieve. Vaccine would like to achieve that. HIV, AIDS, TB, and malaria. Global Fund, can you please provide more? You understand the logic? So the operationalization of quantification is done by technicians. But the result of all that is back to governance, and that's the governance that is holding the vision, implementing the vision, doing the advocacy, doing the policy, doing, okay, we will remove one level of warehousing, the district level, because we believe that the regional level will be able to deliver to the last mile. This is structural. Do you understand?
Yeah, no, I do. Thank you so much, Pierre and Sanjay as well.
Okay, good,
I think it's a lot more
excellent.
clear now. Yeah.
Yes, yes. And it's always tricky. And the reason why we would like to spend more time telling you is that often governance is the root cause of the problem. You need to have a visionary governance. You need to have a coordinating governance. You have to have a governance that is making decisions day in, day out. You need to have a governance that has that is able to have the authority to make this decision, to have technical capacity, to be able to say to the central procuring and warehousing agency, you're not doing your job properly. Number three, UNFPA, instead of signing 12 containers a month of a year of condoms, you will segment that every quarter. UNFPA will say, oh, it's a pain in the neck, 4 shipments a year. They say, well, if you don't do that, then the central warehouse will be saturated and we will have to rent another central warehouse. The central procuring and warehousing agency doesn't have this authority, but because the governance of the supply chain has the authority delegated from the minister, has binding power. It say, okay, UNFP, if you don't align with the idea, then we talk to the minister. The minister will talk to the representative of UNFPA. And I think it makes sense. The country wants that. Nobody else. Okay, now I pass on to Sanjay.
Okay, excellent. So, and in case there are no other questions, so let us quickly move to the next part of today's session, where we try to establish, first, of course, we tell you the 3 key flows, which by now that you're in the last week, you've already understood and figured out. But today, what we want to also address the fact is that these 3 flows, they also get affected based on how supply chain is being governed. Okay, now if you see on the screen, this is the flow of products, where there is a central supply chain organization and everything is managed centrally. So if you remember the first part of the presentation, we talked about whether a supply chain is centralized or decentralized or it is mixed. Now, depending on that continuum, the flow of products will change depending on how your supply chain is, whether it is centralized, whether it is decentralized, or it is mixed. So on the screen, you have a very simple diagram where there is a central supply chain organization, there is a central warehouse, and that central authority is the governing body, and maybe not only the governing body, but they have like a Ministry of Health or someone to backstop them, but they are the one who are making all the operational decisions, at least. So they are the one who place orders to the suppliers. They also have full control over the warehouse, so the products are directly sent to that central warehouse, and they are the ones who directly distributes to the intermediary warehouse, from where the products get distributed to the service delivery points, which are the health facilities or the hospitals. And similarly,
so Sanjay, don't forget to say that the flow of product is green.
Coming to that. Yes. So if you see the color codes here, so the green text, green lines, they mean the products, and the blue line here, it means information. So when it is a central or a centralized structure, the information should also come back to that centralized organization. Now, whether it comes through the intermediary or whether it comes directly, depending on what kind of system is in place. If it is a manual system, then it will come through an intermediary. But if it is an electronic system, then as soon as the data is entered at a service delivery point, everyone will get visibility of that same data. So if it is a decentralized operation, then this simple graph will change. So it will change to something like this. So if you see here, this is something like a decentralized operation. There is no central stakeholder. So every province or a region or a county or a state, these are generally certain terms countries used countries use to, represent their intermediary structures, administrative structures. So in case there is no central stakeholder, then it may look something like this, which already looks a bit complicated, because now there are, let's say, 3 different states which has their own supply chain organization. Each one of those supply chain organization, just like it is in Nigeria actually. So let's say this is an example of Nigeria. So each state in Nigeria, they are responsible to procure their own products. Those products come to their own state warehouses, from there, which are distributed to district or lower level stores or warehouses. From there, it may go to a service delivery point. There may or may not be a district warehouse. I mean, it is a prerogative of that particular state. In some state, there may be. In some states, there may not be. But as you see here, since there is no central organization, the supply chain looks a bit more complicated, okay, rather than the graphic here. Now in this case, there may be 50 different states, but still the central warehouse is the one who is distributing the products to all those states. And an example of this flow of products is actually Uganda. So in Uganda, there is National Medical Store or National Medicine Store, NMS, who is a centralized organization, and they themselves have the full authority on all supply chain related operations, and with the Ministry of Health on decisions as well. Okay, so they are the ones who distribute it to the districts in Uganda. They call it district, and from district to the service delivery points. And if you remember, we discussed these issues in the previous class as well on outsourcing, but it's the same story here as well. Okay, so this is more Nigeria, decentralized. The first one was more Uganda, which was more centralized. We can also say this is also like India. So India also has a very mixed, but still, going more towards a decentralized function, because in India, different states have full authority over their health system and supply chains. Yet there are certain smaller issues which the federal government looks at. So that's why it's more mixed. But if you look at a state level in India, there are 28 states in India. So each state is actually responsible for the supply chain of essential medicines in their own state. So it will again be something like this. Okay. Then let me talk about something like a mixed system a bit more. What happens in a mixed system is that there may be certain product categories or certain supply chain decisions which are taken at a central level or a federal level, let's say. So if I talk about India, there are certain program products like vaccines, reproductive health, these 2 program category, for which all decisions are taken federally, products are procured federally, and then distributed directly to the state warehouses. In comparison, all essential medicines except these 2 program products are procured by the state supply chain organization and distributed within that state. Okay, so that's a mixed system where something is still coming from the federal government, some sort of operational responsibility as well, while of course policy making and funding allocation, those kind of things, the federal government may still have. Okay, in Nigeria as well, federal government has some responsibilities, but it is very, very small when compared to the states, because they have the ultimate responsibilities. So in Nigeria, the funding allocations also happen at a state level. In Nigeria, the donors, they also fund directly the states rather than the federal ministry. I mean, they may do that, but in very specific cases, like for example, recently USAID funded the federal ministry in constructing a very large warehouse in Abuja. That was like a consolidating center for certain program products, which were entering the country. So that was for a very specific nature. But in general, in Nigeria, supply chain decisions, they happen are they and they're taken at a state level, and the federal government doesn't really have a say on that. Okay, so that's why they're more decentralized. So depending on how your governance structure is in the country, your flow of products will be dictated by that. Similarly, the flow of money will also be dictated based on your governance system. Now here we talk about who pays for the products. So for example, in Zimbabwe, I believe it's the patients who pay for the product, because I believe it's some kind of a revolving drug fund mechanism. The program products are definitely they're free because they are paid by the donors, which is the fourth bucket here. But essential medicines are either paid out of pocket or through some, if there are some sort of insurance in the country. I don't think in Zimbabwe the government allocates funding to purchase products. If I'm wrong, please do let me know either in the chat, or you can also unmute yourself and talk about it. But these are generally 4 ways on how products are funded in any country. So they are either paid by the patients. So if we talk about Africa, there are many countries who have something called a revolving drug fund, where a central or the supply chain organization will purchase the products. They sell them at a slightly subsidized cost. Then they pool all the money which they collect, for selling those products, and then that fund is used again to purchase the next set of shipment. So that's a revolving structure. The revolving drug fund is in most countries is initially funded by either a donor or the government itself. But then once that is set up, it is the patients who fund that pool. Okay. The third bucket here, which is funds allocated by the federal government or state governments, which is again a case of Uganda. So in Uganda, patients don't pay for basic products. There are some specialized products which they may pay for in the country, but most of the products in Uganda, they are paid for by the governments and the donors. So the government allocates budget annually in Uganda, and based on that budget is given to NMS, who purchases the products. Of course, donors are there in everywhere in Africa, but they are there only for specific program products. So HIV, TB, malaria is mostly funded by the Global Fund. There may be some malaria products funded by USAID through the PMI Malaria Initiative. There may be PEPFAR funding for something on HIV/AIDS, which is again USAID. Then there is Gavi, who's funding for vaccines, and it is operationalized mostly by UNICEF in most countries. And then there are some reproductive maternal health products, which are again funded either by USAID or some other donor, and operationalized either through UNFPA or any other implementing partner in the country. So these are some program products which patients get for free and funded by the donors. But most of the essential medicines, and in the public sector, those medicines, maybe about 300 to 350 medicine, they are mostly either funded by the government or directly by the patients. Yes, so Tinashe is saying, so there may be certain specific products for which the government may allocate fund. But Tinashe, in general, I believe the patients pay for the products in Zimbabwe. So do let me know if that's the case. So depending on who is paying for the products, so depending on who is paying for the products, so this graph of flow of money may also change, and again also depending on whether it is a centralized or decentralized structure. So on the screen you see it's a mixed system where both central and state level organizations are collecting funds from the facility depending on the type of product and into a DRF scheme. So the products are sold by the service delivery points. That fund is collected at a central pool, but it goes through either a state health service or a central health service department, and then to a state or a central supply chain organization, depending on the type of products that are being purchased, because it's a mixed system. So I'm just trying to show you all the various combinations that there are and there can be in a country, because almost everything we have seen depending on which country that we're talking about. And there are some countries where there are certain provisions, emergency provisions or certain product provisions where they go outside of their standard practice as well, you know. So those are the things which are important to understand, because if you fully understand how product is flowing in the country, how funds are flowing in the country, and how information is flowing in the country, you should be able to figure out how to manage your supply chain. Okay, because supply chain is generally dependent on these three key indicators, I would say. Moving on, in terms of information, uh, there are hardly any country now where the electronic LMIS system is not used now. Majority of countries have ELMIS, and I believe it's the same in Zimbabwe. There is an ELMIS system in the country which is used to collect data and make that data visible from the service delivery point to a central level where it is either seen by and managed by NatFarm, or to the level of Department of Pharmacy Services as well. And based on how that data is collected and utilized, you can create different flow diagrams for your country as well. Now, this is an example from a decentralized system where the service delivery points are, of course, the first layer where the primary data has been collected. Then that data, depending on the system that you're using, it is either sent to the state health department, from there to the supply chain department, and then of course to the supplier. So if you see here, the service delivery points will send replenishment request to either if they have a district or a state level system, which eventually will send their requests to the higher level. Now, since this is a decentralized system, so everything is happening at a state level. So at a state level, the state supply chain organization receives the replenishment requests from either the service delivery points or from the health service departments if they are consolidating those requests. And then that supply chain organization is placing the purchase orders to the supplier, and that's also data, that's also information. So in a decentralized system, each state will be collecting and acting on their information, which may or may not be compiled at a national level. Okay, so if I talk about Nigeria, there are certain program products for which they compile data at a national level, but for the essential products, they don't. Okay, so it's a mix again. There are certain things, since they are managed by the donors, they're also consolidated at a federal level. But since health and supply chain in general is under the purview of the state, they are the ones who manage the information flow as well. Okay, so this is how flow of products, money, and information is impacted by the governance system, who takes those decisions, who manages supply chain. So those kind of issues, they affect the daily transactional system of supply chain, which happens through flow of products, money, and information. And that's why it is important to understand governance before you go into understanding the flows. So if you have any question of this part, I'm happy to take them. The next is a group discussion, which is the last thing for today's session. And I see we have very less time remaining for that. So what we can do is I can take some questions at this stage, and then we can quickly show you the discussion questions, and maybe take a few questions, and then for the remaining, we've already shared the document with you. So you can fill that document up, send it across to me, and I will also involve Pierre in that discussion.
With
And
pleasure.
then we will send you a final document with some answers from our side as well. Okay, but in case you have any questions up to this point, please don't hesitate to ask. And then I will show you the discussion questions for today as well. Thank you. Yeah, please don't hesitate to ask any questions if there are. Okay, in the meantime, let me prepare for the group as well.
Anybody? No?
Okay, in that case, I have to switch off my camera just for a second. So in that case,
Sanjay, are you still around?
yeah, just give me a second. I have to.
So let me take over here. And the question is, what should be the ideal scenario of flow of logistic information within a supply chain? And probably we could take over some of the answer that some of you will be providing to fill this sheet of paper. What is the purpose of collecting and analyzing data is one of them. Are you back, Sanjay? Or
Yep, I'm back.
oh, okay.
Yeah, thank you, Phil. So,
yeah, go ahead.
Shall I can? Okay, thanks. So the objective for this discussion is to understand when we talk about flow of information. So what all is covered in that? So why are we discussing flow of information, and what are the key components of whenever we talk about flow? So on your left, there are these key points, which are the key components of whenever we talk about flow of information. Or we can also say governance of information. So for example, purpose of collecting and analyzing data, what decisions can be made using the data, where should the data be collected from, who should be responsible for collecting, how should that data be stored, what else could be done with the data, and how is data quality checked. So these are some key questions or points, or let's say components, when we talk about governance of data or flow of data within a supply chain. It may not be possible to go through all the questions, but we have about 15 minutes. So what I would propose is that I can ask some questions one by one, and then we do the discussion in plenary. We hear some points from different participants, and then I will write some answers here. And then later I will send you the full document with all the answers. And if you want to add your points into that, you can do that. But the objective of this exercise is for you to understand that next time, if someone asks you about anything about flow of information or governance of data, you know exactly what are the points that you need to focus on. Okay, so we can start with the purpose of collecting and analyzing data. Now here, when we say data, we're talking about supply chain data. So anyone can take a crack. Please, we can start with understanding the purpose, and from there we'll move on to some other questions. So over to you, participants.
Sanjay, when you say data, what kind of data do you mean? Do you mean consumption data? Do you mean data surrounding the supply chain efficiency? Because I guess they have there'll be a different purpose for collecting each different type of data. So when it comes to like turnaround time for orders, etc., you can see that would be really useful for system improvements, but also decision making on how far in advance to place orders. Collecting data like consumption data would help you with your quantification efforts, etc. Yeah, so I guess is data in general.
You've answered the question by yourself, Lou. So all the data that we're talking about is supply chain data. So it can be consumption data, which eventually is a supply chain data. It can be what you said, like order turnaround time. So that's also supply chain data. It can be a data like your stock on hand. That's also supply chain data. It can be a data like order frequency, or data like how much does it take to time does it take to transport from one level to the other level. So all different kinds of data that is within the gamut of supply chain. So we're not talking data like, okay, how many people died of malaria, or what is the incidence rate of a certain disease, or for example, we're not talking about how many patients visited a certain hospital. Those are more clinical information. But what we would be more what we would be more interested to know is how many patients, let's say, were given a certain type of product, if we're talking about the supply chain of that particular product. So again, you answered your question. You're right. Supply chain data can be collected for the purpose of system improvement, to understand order visibility. Of course, consumption data is collected and analyzed for the purpose of quantification, and there can be some other purposes as well.
Perfect. Thank you.
Someone else wants to add to these points, which Lou has already started.
If you remember what I said, it's easy to answer that. No? What is the role of data? Remember the analogy. Remember the analogy of the
I also
and the
think
pilot.
that the purpose of collecting this data could be for budgeting and also raising resources for funding both the products as well as the transportation of the products to service delivery points.
Yep, that's correct. Any other points here?
Yes, making decision.
Yeah, I mean
that's the ultimate.
Indeed.
Collecting data and analyzing data, that's the mean. The end is to make decision on improvement, absolutely. On quantification, on budgeting, on finding resources.
So what we can say here, Pierre, just to add what you're saying, yeah, so that everyone is happy and satisfied. Tadiva is saying data collection analysis necessary for forecasting. Yes, Tadiva, we have covered it under for quantification. So quantification is forecasting and supply planning. Both are included under quantification. So thank you. So I think let's this is okay for now. Now, if we go deeper into these points, which said, making decisions on, actually the second question was to that effect only. So what decisions can you make, based on the data that you're collecting, which of course, like Muzondiva said, you can find more resources, which you actually also responded to the second questions. but there can be like hundreds of decisions which you can make using supply chain data, like very basic supply chain data. Like for example, if I say my stock on hand is below the threshold of my monthly consumption, for example. So what can you do with that data, for example? So who can start the response of second question? What decisions can be made using supply chain data?
I guess if you are finding that turnaround time is really slow, maybe if you are controlling the supply chain, maybe if the turnaround time is too slow and the costs of distribution are high, it might make you consider using a third party to do your distribution.
Indeed. Yep, that's a very good deduction to start with, Lou. Thank you. Anyone else might like to make a similar kind of a deduction that just Lou did, who talked about the data as well, and then led to the kind of decision that should be needed to make supply chain to improve the supply chain, let's say.
Hi, Sanjay.
Yes, Masiva.
For me, just adding on to what Lou said, I think it's mostly just about planning, right? So let's just say you're below your minimum stock levels, right? Then you know that maybe for next time you need to order a bit more, right? So that you then will make up that gap, or vice versa, where the other way maybe it's you have a bit more of a certain stock, then you know that next time you can order maybe a bit less, just to make sure that you don't medication doesn't expire on you, or things like that. So for me, it's mostly just about how do you plan for next time. That's what the data is really for. And how can you improve, how do you plan for the next cycle, or the next whatever.
Yeah, absolutely. I can also say order cycles here. So absolutely, so that is a very operational decision for any health facility, for example. So you look at your consumption data or your stock data on a week to week or a month to month basis, and depending on your order cycles, then you would be in a better position to know how much to order, whether you're ordering less or you're ordering more. So data can be analyzed, and then order decisions can be made based on the analysis of those data. So similarly, like I said, there can be hundreds of decisions if we go deeper into supply chain systems, from stocking to transporting to ordering, dispatching. Then these are more operational. Exactly, these are more operational to more system improvement, like Lou said, that okay, it is internally our indicators, they're not very good, so let's go for outsourcing. Or the manual LMIS is not working, so let's go for an ELMIS system. Oh, but we don't have a data culture because the reporting is very poor, so let's train more people into how to report, or maybe install or instill a culture of reporting in the system, so that the ELMIS that we have invested upon can actually bring forward some good results. So there can be multiple decisions that you can take, mentioned above, not the ones for the second part of the sheet. Yes and no, Margaret, the question that you've asked. So the purpose of collecting data is to make decisions, is to plan supply chain, is for budgeting or resources. But the second question is trying to take you deeper into those decisions, like what kind of decisions can you take? So the slight distinction here. The first thing is asking that, okay, what is the purpose? The purpose is to make decisions on several issues. The second question is asking you to go deeper and figure out what different decisions can you make. So it is, let's say, a subset of the first question. Okay. Then we can go to the third question as well, which is rather simple one. So what all sources or levels at which you can collect data, or you should be collecting data? And it's a very simple question. Anyone can answer this. Yep. So what should be the source or sources or levels? Can be singular, it can be plural, where the data should be collected from. Yes, Muzondiva.
I think they should be, the data should be collected at all levels.
Okay, all meaning, so Vivian says service delivery points.
Yeah,
So I can
think
also,
from the,
so I can add another question to this, that let's say it is a service delivery point. So what data are you collecting from a service delivery point?
yeah.
So like Muzondiva mentioned, it should be from all the levels. So let's say then there is central warehouse as well. So what data would you collect from a service delivery point? What from an intermediary warehouse or store? And what data will you collect from a central warehouse, which will help managing your supply chain? So that's also important. Not just to say that, okay, we know the data should be collected from all levels, but what type of data? Yes, Vivian is correct. So consumption data should be collected from service delivery point, and that is the most important data that must come from any service delivery point. Any other ideas on the other levels? In the meantime, some of you can also start to think about who should be responsible to collect data. You can think from your current perspectives to an ideal situation. Ideally, who should be collecting these data that we're talking about? So we're just 1 minute left for this session. So I will stop at this question: who should be collecting data? I'm just waiting for a few more responses. And then, yeah, Lou, go on.
So I guess it's the individuals who are based where the data is generated. So I guess most of the data, as we saw in the diagram, was generated at the service delivery point end. But there will be some data that is generated at different points during the supply chain. So say, for example, there'll be like costing data that's central. There'll be ordering data and consumption data that is at the service delivery point. So I guess the responsibility for collecting that data would lie with the individuals who are overseeing that point in the supply chain.
Yeah, but let's say if we talk about health supply chains, who are the most likely candidates at each of these places? That's one part of the question. The second part of the question is, ideally speaking, under whose job description should this role be?
Yeah, so I think I believe that in Zimbabwe there is at Nat Farm there are logistics management units, and there are logistics management officers who are based in the individual regions. So they are the ones that would see the data available for the various different provinces, and then that would be compiled from different districts and then reported up into the central logistic management unit, and that I believe was established by USAID, that logistic management unit.
Okay. So that's looking at compilation of the data. But anyone else would like to take a crack on who should be collecting it at a service delivery point, or who is more likely to do that job? Ms. Ondiva? Yes, go ahead. Yep. So Vivian is writing pharmacists and pharmacy technicians. And Vivian, you are absolutely right. The most likely candidates at any service delivery point are the pharmacists or the technicians, given the fact that these are the staff who are managing the dispensaries or the stores. And since in most countries, there isn't a dedicated position for collecting data, so these are generally the staff, pharmacists or the technicians who are most of the time collecting data. There are several reports and instances where they can be nurses, nurses who are managing operation rooms, operating theaters, or nurses who are managing vaccine centers. They may be like midwives or nurses or just nurses. They are also responsible for collecting stock data or consumption data. And the reason why pharmacists or nurses, they are collecting data, is because in our systems in public health, in most countries, we don't have a specific job description of a data officer or a data and information officer, those kind of thing. I mean, it's good if NatFarm has created regional positions of logistics management officers who are at least compiling that primary data. But the fact of the matter is, until and unless we have dedicated officers, at the service delivery points, our data goals, they will always be a bit deficient. Now, I wrote a case study in 2014 from a state in India where the state recruited 3,000 data officers to be placed at, initially they were placed at about 70% of the service delivery points. And for 3 years, their ELMI system was showing some 92 to 93% data collection percentage, so ratio, like from all facilities. So 92 to 93% facilities were reporting data, and at a timely manner, because the pharmacists and the nurses, they were doing their jobs, and there was a dedicated data officer who was doing his or her job. But then even in that state, after 3 years, the government had to reallocate that position to some other job, because in general, in supply chains, we don't always have a data officer as a logical job role, and hence it falls back to pharmacists and nurses. And after those 3 years, the data collection, data reporting ratio fell to something like 70 to 75%, because that's not the primary role of any pharmacist or a nurse. Their primary role is something else. So these are the things that we should be asking when we talk about any data governance, flow of data. There are some other questions that you can look at by yourself. We will be sending you a document later with all the answers. You can also reflect on that. But as a summary for today's session, while I am launching the poll for today, the feedback poll, the summary for today's session is that governance of supply chain is an important issue, which is in most cases, not talked about. It's not talked enough, I would say. at any country level, we are mostly worried about operational systems, operationalizing our systems. We don't really talk about who is actually taking those decisions, and how those decisions affect the operation of supply chains. In many countries, they develop policies and strategies and revisit strategies, but then those strategies and policies do not percolate down to the right levels which they should. Pierre, you have worked on in many countries in revising their supply chain strategies, in creating or redesigning their warehousing or transportation strategies. And I see
Sorry.
your cat is also part of the discussion. But
Yes.
what would you say your experience has been when it comes to implementing those strategies, in the entire supply chain? How far these countries or donors and implementing partners, they have reached in making sure that everyone understands, everyone in the system, they understand the policies and the strategies, so that everyone can manage their job roles in the most effective manner possible. Back to you as a
Look,
summary, and then we
yeah.
end the session. Thanks.
Very quickly, I supported 10, 12 countries to develop their strategic plan. Asia, Africa, you name it. And I believe the best analogy is the pilot of the aircraft. Is that the pilot of the aircraft has responsibility. He has or she has a roadmap. And therefore, if you have that, and if the strategic plan is the roadmap, and you have one pilot that is governing, coordinating, and has sufficient leadership over the stakeholders, all the stakeholders, central, intermediary, and peripheral, things will move. If you don't have that, then the roadmap, the strategic plan, will be partly implemented, will not be implemented, or will be mediocre with little ambition. Number one. Number two, will be not a strategic plan. A strategic plan should talk about strategy. How many layers do we have? Central, intermediary, 2, 3, 4 intermediary, then the peripheral. That is not right for the supply chain. So a strategy will be reforming. There will be no reform if you don't have the pilot of the aircraft. The pilot of the aircraft has 2 wings in the front, 2 engines in the back, a wing, a central wing, then several tires, the fuel to refill. All this has to be overseen, and decision should be made on real information, not on just wishes or private or personal interest. So to answer specifically the Sanjay, without governance, formal governance, there's so many informal governance, nothing or very little will happen. That's always the root cause of chaos. Back to you, Sanjay.
Yeah, thanks, Pierre, for the summary. Although the plane you're referring to is quite old. Today we have 4 engines in a plane, most of them. So
the one that I fly and that I flew yesterday had 2 engines.
Yeah, so cool. Thank you so much, Pierre.
It was Air India, by the way.
Yeah, we are still behind. So sorry. Yeah, so thank you.